I want you to speak to the importance of diet and going back to carbohydrates and how those are implicated with SIBO. So what are your thoughts on the low FODMAP diet? First off, what is that? And then how does that help improve symptoms of SIBO?
Yeah, so the low FODMAP diet is essentially, at its core, it's taking out highly fermentable carbohydrates from the diet. So what this means, highly and rapidly, meaning so as soon as they hit the small intestine. And so just so people have a sense, is the small intestine, the duodenum, is just down the road from your mouth. I mean, so once the digestion takes place in the stomach, if there are bacteria sitting in the duodenum, which is the first 12 inches of your small intestine, and it meets a highly fermentable carbohydrate, you can get increased gas production. So what the low FODMAP diet does is it reduces foods that would potentially increase that gas production at those early moments of digestion. So basically it removes things like lactose and high fructose foods and these forms of carbohydrates called galacto-oligosaccharides and fructo-oligosaccharides and polyols. And so this diet is really useful kind of from a public health perspective, meaning like a lot of people who don't have access to getting good care, and they need something just to get by and feel well for a while so that they can travel, they can go to work, and they can function. And so this particular diet can help those people get by. It can reduce some of their symptoms and gas. Now, does it fix SIBO? There's not a lot of evidence that it does. So, and people can get kind of stuck on that diet and get kind of limited. And then the more limited the diet we have, the less diversity we have. And there's some studies that say that you should only be on it for about 3 months. And then you start to see butyrate producing species decrease and some other really important species in the digestive tract. So I think it's great for getting people to feel well so they can focus on these other long-term repair items.